Len Bruce, Acting Executive Director of Medical Services, Murrumbidgee Local Health District. Good morning, everyone. Welcome. And it's now been 2 weeks since our last COVID-19 update for the Murrumbidgee Local Health District. So once again, good news. We've had no new cases now for approximately 6 weeks, which is great news. So we have a total of 45 patients who had COVID-19 in the Murrumbidgee Local Health District. Sadly, one of those patients passed away. All the other patients have recovered apart from one. So that's very good news for us. The other bit of good news is that the total number of patients tested for COVID-19 this morning is 9,314, which is great, and not that we're competing with the other LHDs, but we've moved out of the last spot and we're up there with the, with the big boys, which is really good. And I think there's been tremendous community engagement, a lot of work done, and once again in the country we're innovative, and we've got our mobile testing van, and we will now have a van next to the highway. So we're doing all sorts of different things because we want people to test. It's really important, and I'm sure most of you would be aware of the sad case in Queensland where a 30-year-old person passed away who'd been unwell for a while and didn't get tested and died. If you're in any way unwell, the mildest of symptoms, get tested, because then we can identify and look after you to make sure that you don't deteriorate. You don't necessarily have to go into hospital. We've got our virtual ward and we can look after you at home, but testing is absolutely essential. The other bit of good news is that recently we've been able to do more testing at the laboratory in Wagga Base, and our turnaround time now for a test is about 30 hours. So we know it's an inconvenience for people to take time off work, but now it would really be one day, and it's probably not a bad idea to stay away from work when you're unwell, because even if you don't have COVID disease, you don't want to go and infect your colleagues with one of the other viruses that are more prevalent during winter time. And the other bit of information that I've shared with you before is that if you recover and tested negative and you become ill again in the future, sadly you need to have another one of those tests, because we will not be able to guarantee that it won't be COVID the next time. And the way for us to manage is to identify people with the illness, firstly so that we can make sure that you're in isolation, but also that we can keep an eye on you, that if you become unwell, that we can get you into hospital soon and treat you appropriately. And once again, I want to reassure the community in the Murrumbidgee that we have, through a lot of hard work, created capacity in the intensive care unit to make sure that everybody here will receive the care that they need. Any questions for me?
Is there any reason, the person that still hasn't recovered, is there reasons for that, any of grave concern, or is it just taking them longer?
I think that the standard for complete recovery has been increased quite significantly. It's very common for people who've had a viral illness to get a cough afterwards that can sometimes linger for weeks even though they've recovered. And the current standards are that that cough has to disappear before we see you as recovered. But we're quite sure that they're not infectious, and they're well, and they're definitely at home and not in one of our hospitals.
Are you concerned that people might become a bit complacent about social distancing and hygiene measures, considering that there only is one active case in the area?
Yeah, it's very interesting. I've just come off another meeting with the members of Parliament, and that's our main concern, is that people will forget why we've done so well. And the reason why we've done well is we've all worked together, and it's been an impact on people's lives, not being able to go out and visit family and friends. And especially now with the restrictions being relaxed, those other factors like hand hygiene, cough etiquette, maintaining social distancing if you can, is even more important, because up till a few weeks ago we couldn't go anywhere, but now we can, so it's even more important. And we probably will see more cases, but we can minimize it. And as I've said before, the only way to get COVID is from another person, and it's not an airborne spread, it's a droplet. So in other words, somebody has to be close enough for the droplets to get to you, or you have to go and touch the surface that they've touched. So yes, it really is something that we are worried about, and I know I sound like a broken record, but this is really important. We need to keep on doing the right things.
Are you concerned about a second wave?
We are. We would think that there could be other outbreaks, but if we manage it appropriately, and I think we are well prepared, the impact will be less. And Australia's done extremely well, really, probably one of the best countries in the world, and we've done very well in New South Wales too. But we are better prepared. But you never know, unfortunately it's unpredictable. It's a very new disease, it's been around for 6 months. So we don't know, so we are concerned, and that's why the preparation is continuing. The MLHD is doing repeated scenario testing to make sure that if we have an outbreak in a residential aged care facility or in a hospital, that we can respond quickly and effectively. So there's still a lot of work going on in regards to COVID.
Do you harbour any concerns about Monday? I guess heading into the increase in pubs, the beauty industry getting up and going, or?
I think the important information there is the caveat about following the regulations. So the Health Minister was very clear, you need to be able to meet the requirements, and I think the most important thing is that if you're unwell, please don't go. Even the mildest cough or sniffle, please don't go. The last thing we want is an outbreak, and well, firstly your beauty salon will then be closed down, and the last thing we want is to go back to the more severe restrictions. Now, just one other bit of information is that the public will be aware that there's been direction from the National Cabinet that we can start to resume elective surgery, and New South Wales Health has provided us with permission to go to 75% of the surgery that's been deferred by the end of June. So we're busy working through that. So we've started doing cataract surgery, joint replacement surgery, and for families with children waiting to have their tonsils taken out, the first lists were done yesterday. So we've recommenced most of the services, and we just have to work through the patients where surgery has been delayed for very good reason.